Hi, it's Jeremy Rodrigo again. Welcome back to another edition. In this special series, we talk about why our work matters right here in our community. And today I'm joined by Dr. Kweku Sam, who is a pediatrician at our pediatric office located right here in Middlebury. Dr. Sam, thank you for joining us.
Thank you. You're welcome.
We appreciate Dr. Sam and all of the pediatricians and providers that care for our children here. So tell me a little bit about this practice here in Middlebury. We know that it's the largest pediatric practice in the area, so tell me about this practice.
I think the most unique thing about our practice is that 3 or 4 of our providers have been together for close to 25 years.
So you've all worked together for a long,
Yes,
long time.
yes. So that's what really provides the stability of our practice. But currently, there are 6 physicians and 2 nurse practitioners. And we work very, very well together as a group.
So with 6 physicians and 2 nurse practitioners, how many patients do you see a day here?
We have approximately about 120 to 150 families trooping in every day because that's our daily census.
And how many days a week are you open?
We're open every day.
Really?
So we're open Monday to Friday, regular hours. So we start earliest at 8 a.m. and somebody is here till 7 p.m. every night. On the weekends, we're open 9 till about 12, or, on busy days, we stay till 1 p.m. And every day of the year, we're open, except for Christmas Day.
Except for Christmas, but you're always available by phone. I know
Correct,
that too, right?
correct.
So
We
tell
are.
us about that.
We are.
Family is having an issue with a child, they're at home, he's sick, cough, whatever, and they're nervous. They want to call and they want to talk to a doctor. How does that work?
So, throughout the day, when they call, they get access to our triage nurses. We always have 2 very experienced triage nurses that are covering the phones during the day. After hours, it goes to our answering service, and then they page out to our phones so that we return the call to the families.
So you're never out of reach of a pediatrician when you want to speak to them.
Yes, we're very available.
And you have relationships with patients that last years, right?
Correct,
From birth,
correct,
right?
correct.
How does that relationship start? We talked about it once before. How does that relationship start?
So typically, it starts in different ways, but one classic example is when a newborn has been born and we meet up with a family in the hospital. It gives us the opportunity to examine the healthy newborn, talk to the parents, mom and dad, about, the care of the newest member of their family, or the latest, new addition to their family, if they're a young family. And that's really where the bond forms. And, we respect the families, and they in turn look onto us to provide them with guidance and a lot of, care throughout their lifespan. And I'm glad to say that some of these children we've taken care of, and they in turn have had families of their own and brought them back to us. That's the joy of what we do.
So a whole new generation.
Correct.
So you just brought up a point that was really important, is you don't just take care of the patient, the baby or the child or the adolescent, you're taking care of the whole family. It's a whole family affair.
We really are, because, families walk in with simple questions, but behind every question there is an issue, if you dig a little further, that needs to be addressed. And as every parent knows, if you question an astute 3 or 4-year-old, they blurt out what's going on at home. And that needs to be addressed as well. So we really get to form a bond with the families, and they see as a family member that sits on the wall somewhere and, gives advice.
And that is true, because you have taken care of both of my kids, and we, do see you as part of the family.
Thank you.
We got to call Dr. Sam and ask him about this.
Thank you.
So you also did some work in the schools, right? And so tell us about the work that you've done in schools.
Correct. So about 2 years ago, when the initial COVID crisis was winding down, I did work with the Waterbury school system, helping them with the COVID guidelines and practices. And right now, I'm working with Region 15. So the Middlebury and Southbury schools. I'm available as their school medical advisor. So,
Okay.
they call me with questions and consults that come up, and I meet with the nurses periodically to discuss policy for the running of their health systems. Yes.
And that's important because it's not just that our pediatricians are taking care of patients and families, but you're also really out in the community. And this is what this series is about, is what we do in the community.
Correct.
And you're caring for our community. So
Correct.
Tell us why, in your opinion, you feel that the work we do in this community, and we're the largest pediatric practice in the greater Waterbury area. Why is the work we do in our community so important?
Yeah, we feel it's very important for a variety of different reasons. We primarily are here to monitor growth and development in children, and also monitor their overall health. We offer preventive care, vaccinations, and early detection of potential health issues. We're also available to provide guidance on nutrition, behavior, safety issues, all with the idea of contributing to the daily health status of the children, and also ensuring their long-term health. We start screening for diabetes and high cholesterol and hypertension in adolescents, and that's why we want to meet with them every year to check on these things, so that by the time they're graduating out of our practice, they have some education on monitoring these common adult concerns as they move on to adult providers.
And typically, what age is it that a patient will graduate on into adult primary care?
So yeah, we do pediatric and adolescent care. The definition of an adolescent goes on to about 21 years of age. But you and I know that some of them linger on, and they go off to college, but once they're back, they reach out and they may have a question here or so. And I believe strongly that we provide care that they find difficult getting once they leave here.
Right, and because the care that you provide here, and I say this from experience, is so personal and so personalized.
Right.
That you really feel like you're being really well cared for here. Like the providers really care. Now I only have you as was my pediatrician. Both of my children are grown, but they loved you, right? They absolutely loved you.
Thank you.
And so as we finish up today, I want to thank you for taking the time. And if there's any pearls of wisdom that you want to talk to anybody about, and I think you just kind of underscored it, but why is it important to have a pediatrician? Why is it, just recap, why is it important for you to have that relationship with a pediatrician early and visit the pediatrician often?
Yeah, I do think that, a lot of people think of pediatricians as we're treating colds and coughs and all that. Yes, we do that, but the crux of what we do really is monitoring growth and development, and the surveillance that we provide in nutrition, especially behavior and safety. When I started practicing in this community, the majority of our practice was in infectious diseases, because children were catching pneumonias and meningitis, and we spent 2 hours in the morning rounding before we got to the office. Because of vaccinations, that has changed around. And we're in the business now of monitoring behavior and advising on behavior, and providing a lot of mental health care as well, in terms of initial counseling, and also assessing children for anxieties and depression. All of you would recognize that these conditions have increased in our community. So our care has sort of delved more into mental health issues as well.
So it's mind, body, the whole
thing. Exactly.
We want the overall wellness.
Yes.
Really, of the child and the family.
Yes, and really also a lot of anticipatory guidance. So if we realize that you're getting into the adolescent years, we know that the issues are going to be drugs and, relationships and, safety issues. So we start advising even before they get into those issues, so that if they're confronted with those, they sort of have a mind of safety behind them as they move along.
And it was information and it was advice delivered to them by somebody they trust, that they've known for a long time.
Exactly.
And that's important.
Exactly.
So Dr. Sam, thank you so much for joining
You're
us
welcome.
today. We really appreciate it. Dr. Kweku Sam is a pediatrician at the Alliance Medical Group Pediatric office. It's the largest pediatric office in the greater Waterbury area, seeing 120 to 150 patients every single day right here in Middlebury. Thanks for joining. We'll catch you next time.